Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel if you have not. If you are little thoughtful, then you can subscribe after watching this video. This is Dr. Bhupesh and today we will discuss about the writing. What are the different kinds of writing which can come in the exam? What does examiner see? What are the main points which you need to cover when you want to score 350? That is B. How to get B grades? So C positive is not a very great grade, but at last it gets us pass. But if you want to score B or 350, then this video is certainly going to help you. Our contact number is 76967342256. If you like this video, you may call us on the same number for the best OET coaching. If you do not like the video, even then I will tell you that you may subscribe this channel and you may contact on the same number for the best OET coaching, but I will try my level best to make this video wonderful for you. So the first thing I would like to tell you, what is the main thing in the writing that I always say? Do you know what they are scoring you for? Suppose if you are a nurse in UK, you are working in a hospital. What do they want from you? An email. And what email? Email means they want an email where you just can tell the doctor or to the person whom you are writing. Suppose you are writing to a community health nurse. Please understand this fact. I'm making it very simple today. Suppose if you are writing to community health nurse, you are writing to a physiotherapist, you are writing to a psychologist, you are writing psychologist. Sorry for the spelling. I'm not bothered about the spelling at the moment, but in final exam, spelling matters a lot. You cannot do even a, I should not say even a single, but try to avoid every mistake related to spelling. Spelling mistakes are not allowed. By chance, if you do one spelling mistake, that's fine, but we should completely, these are the places where we lose marks. Sometimes people do mistake of spelling of referred. They every day they use referred, then they do the spelling wrong. So please make this spelling correct. Refer, refer. Then you write red. So there are two R's, one F. So please don't do this silly mistake. Spellings hold lot of importance when it comes to getting marks. If you are doing any mistakes in spellings, please write them 5 times, 10 times, and try to copy the spellings from the question paper. So if you're writing to a community health nurse, you are writing to a physiotherapist, you are writing to a psychologist, you are writing to a doctor, ophthalmo, whomsoever you are writing, the only thing they want from you when you would be nurse over there in UK, New Zealand, Australia, Ireland, Canada, US, what they want from you is just an email having the right purpose. What do I mean by the purpose? Purpose means if a patient had a fracture, had an accident, he has bruises, he has a fracture, he had a head injury, he has one brother, he has diabetes. Please understand this stuff. But these are given in the big lines, but I'm just telling you. Has hypertension, uh, suppose he's having some mental illness, depression, maybe after out of the depression he got an accident, whatever the reasons are. Now let's consider different doctors. That is what you need to understand. That is how simple OET writing is. If you are writing to community health nurse, community health nurse has nothing to do with accident, but if you're writing to community health nurse, that he or she will provide follow-up care. So fracture, not concerned about the fracture, but after fracture care, post-operative care means fracture would be dealt by orthopedician. He will put plaster of Paris or plaster cast. Then patient will be given the follow-up care, and the follow-up care would be provided by the community health nurse. So the overall community health nurse, the main topic is this letter is being written regarding Mr. X who had fracture due to an accident. After fracture, he got, yeah, after fracture required treatment was given. Yeah, for fracture required treatment was given. Now he is better, but he needs follow-up care, full stop. Therefore, he is being referred to you. Means follow-up care is the main word. That is the purpose. Purpose can be just one word. You can simply write this letter in a way. This letter is being written regarding Mr. X who needs follow-up care. Therefore, he is being referred to you. Even then, purpose is clear. So when you get a very complicated letter, then if you do not understand anything, just mention the follow-up care word. So this letter is being written regarding Mr. X who had an accident leading to fracture or who had fracture due to an accident. Please listen to these lines again. Pause it, listen to it again. Who had fracture due to an accident or who had this accident leading to fracture, full stop. Required treatment was given and his condition has improved, full stop. But after full stop, rather than but, the better connector is however. However, comma, he needs follow-up care. I will write it for you. However, so this is the main line of the purpose. So we think the purpose is fracture and all that. No. However, he needs follow-up care. This is the purpose. Follow-up care. So he is being referred to you. Now, by the time I am doing writing, also I will tell you rest important things like connectors. This video would be a complete video. Just give me like 20 minutes to sort out, but you would be knowing lot of things. He needs follow-up care, so he is being referred to you. Now, rather than so, you can also write therefore, but that is what OET says. If you are putting a full stop, then do not use small connectors like but. That is what OET says. Don't use but. If you're using a full stop, then use a bigger connector. However, in the same way, when you are using a comma, you can use so. But when you are putting up a full stop, then write a bigger connector. Therefore, then do not use so. That is what OET wants to say. So they say after a full stop, use a bigger connector. But the main purpose is this follow-up care. So first paragraph is always reserved for the purpose, and this paragraph, if right, 90% you will pass, because that is the main thing they want from you. If you write the purpose well, you do the grammar well, and and you do not do any spelling mistake, even if by chance we are allowed to write 180 to 200 words, even if by chance you write 220 words, they will still give you C positive or B very easily. By chance, if you write 220 words in the final writing, do not erase it. These are the stupid things people do. Don't do that. Don't erase if by chance you write 220 words. If always in the start, try to use the data which you are sure of. Suppose if there is any data you are not sure, then leave that line. Suppose after you have completed your letter, you have written 175 words. Now, the line which was confusing you, you write it in a simple way. Please note. Last line, please note. The patient, he is also having hypertension. Suppose you were confused whether to write hypertension in this letter or not, then that is the best way. Do not write it in the start. Write your letter which you are sure of. Then in the last, you can say, please note he is also having hypertension. Now 175, 176, 177, 178, 179, 180, 180, 181, 2. Means your word count also becomes complete. Your information becomes complete. Do not write anything which you are not sure of in the middle. So now coming to the basics again. First paragraph, purpose. Second paragraph, social history and medical history. Third paragraph, if hospitalization has been done, then hospitalization. Otherwise, past visits. And fourth paragraph, that is purpose in detail. So that is purpose in brief. That patient needs follow-up care. Therefore, is being referred to you. So first, purpose in brief, social history, medical history, hospitalization, past visits, and purpose in detail. So that is what you need to know about OET letters. Now coming to this main thing again. Suppose if you are writing a letter to the physiotherapist, again you will tell a physiotherapy patient had an accident, required treatment was given, his condition has improved, but however now he is having problem regarding his mobility. So obviously, if you are writing to a physiotherapist, that would have been the main problem that regarding his ambulation or mobility. And that is the best part of OET. This would be given in the writing. So you have to select the data. In OET writing, you don't have to create data. You have to select data. What is important according to the person whom we are writing the letter. So I'm considering the same letter, patient having bruises, fracture, head injury, has one brother, diabetes, or maybe I can use alone. Suppose he does not have a brother, he is alone. So he is alone, having diabetes, hypertension, depression. So if I am writing to physiotherapist, again, this old data is almost waste. So means according to OET, the most important thing is to whom you are writing the letter. That is the most important thing. I hope you all have understood. Now taking this example further. Suppose if you are writing to a psychologist, then you can say he had a head injury. You will talk about depression. You will talk about head injury. You will talk about accident. If you are writing to a orthopedician, then obviously this letter is much simple. This letter is being written regarding Mr. X who had an accident. Now he is suspected with fracture. Therefore, he is being referred to you for confirmation of diagnosis. Mean you tell the orthopedician that he is being referred to you for confirmation of diagnosis and the required treatment. I will write this thing for you. So if you're writing to the orthopedician, then main line becomes this. This letter is being written regarding Mr. X. It will not take time. Just understand what OET writing is. How to find the purpose depends upon to whom you are writing the letter. So who had an accident and he is suspected with fracture. Now you are sending to orthopedician, so obviously you want to confirm the fracture. Therefore, he is being referred under your expertise for definitive diagnosis and further management. Definitive diagnosis mean that we are not sure and further management. For the students who are listening to the writing video for the first time, they must be wondering, how can we use the word suspected? Where should we use the word diagnosis? It would be given. If in OET examination question paper, it is given diagnosis, fracture, question mark. That means the patient is suspected with fracture. If question mark is not given, that means patient is diagnosed with fracture. So then you will refer to the orthopedician for the required treatment. Then you will not say definitive diagnosis. Definitive diagnosis. Sorry, very important word. Definitive diagnosis. So means OET letter depends all upon to whom we are writing the letter. If you can find the purpose, then you will always write it fine. The major letter that I think that can come is like a referred back letter. Referred back letter majorly comes to GP. This is a very important letter that will tell you a lot about OET. Referred back letter majorly goes to GP. GP means general practitioner. Means if we talk about India, it's like MBBS doctors. So GPs, general practitioners, they have their clinics. So referred back letter means patient had an accident. He comes to the clinic and then GP feels it can be fracture. Again, that question mark, diagnosis, question mark, fracture. So GP says diagnosis, fracture. What will GP do now? What will MBBS doctor do? He will refer the patient to orthopedics. Orthopedics. Now the senior orthosurgeon, what he will do? He will do diagnosis, definitive diagnosis, and management. Up to this, these two letters are same. But what happens in a referred back letter, then orthopedician provides the treatment, means plaster cast and treatment. And that obviously happens in the hospital. So means hospitalization also occurs. Then what will happen to the patient? He will become better. When patient has become better, then what he would be done? He would be discharged from the hospital. Now after the discharge, he will need follow-up care. And who will provide the follow-up care? Again, the GP. So now this is a referred back letter. Patient had an accident, went to GP, then from GP to orthopedic surgeon, and then from orthopedic surgeon back to GP for the follow-up care. This is what is known as referred back letter, because GP referred the patient to orthopedics, orthopedics referred the patient back to GP. That is a referred back letter. This is the most common letter that is repeated. Now you can well understand when patient goes to GP first, so GP already knows about the social history and medical history. In these kind of letter, second paragraph, social history and medical history are not required. That is different about these letters. In this letter, you can make two paragraphs of this, or you can make two paragraphs of this purpose in detail. So it depends upon what data is given. So you can break the data into two parts. Either second paragraph you can make two, or third paragraph you can make two. Normally you should make four paragraphs, 50 words each. 50 words each means it is not mandatory 50 words. So one you can make 40, other you can make 60 to make a balance of 200 words. That is what OET letter is all about. Now if you have to write this letter, so again I will copy paste it. OET format will remain same. You just have to make it working according to the letter. Now I'm writing the letter of this thing, that patient came to GP. GP sent the patient to ortho. Ortho gave the treatment in the hospital, and now patient needs follow-up care. So this letter is being written regarding your regarding Mr. X. Sorry, this let now orthopedician or orthopedic nurse is writing the letter to GP. This letter is being written regarding Mr. X, who was referred to our hospital due to suspected fracture. That was the thing, na? GP was suspecting the fracture, question mark. So this letter, so now orthopedic nurse is writing back to GP. This letter is being written regarding Mr. X, who was referred to our hospital due to suspected fracture. So who was referred means passive voice, who was referred by you. So we are writing to the GP and saying who was referred by you to our hospital with the suspected fracture. Then what did we do? We did required treatment was given, and now his condition has improved. Simple. There is nothing complex. Now his condition has improved. It's almost done. Now his condition has improved. So what will happen? Therefore, he is being discharged. So when you have improved the condition of the patient, so you will discharge the patient. Therefore, he is being discharged. But he needs follow-up care. So you are saying, but he needs follow-up care. Being his GP. Being his GP means that you are already the GP, general practitioner of the patient. You are requested to provide the follow-up care. This is the most complex letter maximum that can come. You are requested to provide the follow-up care. Sorry, provide the follow-up care. Now see the letter. Very common letter which is often repeated in OET exam. So this letter is being written regarding Mr. X, who was referred to our hospital due to suspected fracture. Required treatment was given. Now if you will see, do you know what is missing? That is what OET is all about. When you will revise the letter, it is known as proofreading. So when you will see the letter closely, there is one point missing, that suspected fracture. Now whether the patient has fracture or not. So you will say who was referred to our hospital due to suspected fracture. Here means in the hospital he was found with fracture, for which, now this is a superb connector, for which required treatment was given, and now his condition. Now this is a complete letter. That is what I want to tell you, that first what we wrote was good, but there was suspected fracture, so you did not confirm the fracture. So it would be given in the data, but when you write the letter, it should be complete. So now the purpose is complete, that he was having suspected fracture. After fracture, here he was found with fracture, or you can say here fracture was confirmed with an X-ray, with X-ray, for which required treatment was given. If plaster cast word is given, you will say for which plaster cast was applied. So this is the main thing that I want to teach you, that when it comes to OET letter, the major thing is the purpose. If you write this first paragraph well, you are all good to pass. Now in this kind of a letter, obviously the word count would be more. If I count the word 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 into almost 5, it will make around 65 words. So I have already written 65 words in the first paragraph. Obviously, the rest of the paragraph, if I do 190 words, 190 minus 65, it should be 125 words. If I divide by 3 paragraphs, so you are writing almost 41 words. That's it in the next 3 paragraphs. So obviously the first paragraph becomes bulky when it comes to referred back letter. When you have referred back letter, the first paragraph becomes little bulky. Then the second letter, which I think was the letter of today. There was a specific point in this letter. What was happening in today letter, what we have provided you? You belong to a community, you are a community health nurse, and the patient is coming to your center since 2007. You need to understand the story. First paragraph is all about making a story. So patient was coming to your community health center since 2007. But now he is moving to Marlborough. Why? For better access to the treatment of multiple sclerosis. For the better treatment. So he is moving. So now you have the purpose. So purpose is he is moving to this place, and you are writing to the community health center in Marlborough, that patient will take your care. That patient will attend your community center. He will attend your community center now. Let me make it simple. He will attend your community center now. Now this was the letter of today. Now please understand this letter. How to write this letter? What is the first paragraph? When you read the whole letter, you understand this thing. Community health center is our center. He was visiting since 2007, but now he's moving to Marlborough for the better treatment. Therefore, he will be attending. Now let me give you an example. Suppose if the patient was living in Delhi, he was attending community health center Delhi, but now the patient is moving to Mumbai. Why? For the better treatment of multiple sclerosis. So would he come from Mumbai to Delhi? Delhi for the community health center? No, he will attend the community health center in Mumbai. That is how simple this understanding is. That why would he come from Mumbai to Delhi every day for community center when the main purpose is multiple sclerosis? His main disease is multiple sclerosis. So in this letter, nothing to get confused, but I want to tell you a very important point, very special point. This letter is being written regarding Mr. X, who is attending our community center since 2007, since March 2007. The main point I want to tell you over here, OET says when you write who is attending our community center since 2007, first, it is grammatically wrong. But still, if you write everything good, considering this grammar mistake, they will still give you C positive or maybe B as well. I'm not saying C positive is the minimum. Because of one mistake, they will never fail you. They will never fail you because of one mistake. But if you want to get A, then this is the most important tense because it is very less used. If you can remember this tense, whenever you are using continuous tense with the time, then always say has been ing because it becomes present perfect continuous. So this type of grammar gets A grade. That is what OET says. If you know the tenses, then you will get A grade. This is the most important sentence I want to tell you. Please remember this thing. I will tell you one more grammatical sentence which will fetch you more marks, but don't use it forcefully. If it is in the letter, only then use it. So whenever you get anything that he has been attending community centers since March 2007. Suppose if by chance you miss out on this comma, still they will not fail you because of comma. Don't worry about very small things. Today I am making this video to tell you how much margins you have. Then you did not put this M capital. You should put this M capital, but still because of this small m, still they will not fail you. But please take care, Mr. X, comma, who has been attending since March 2007. That is how you put it. Now understand. But he is moving to Marlborough. I told you after full stop you cannot use but. So you say however. However. However is equal to but. But after full stop you use however. However, he is moving to Marlborough now. Why? For the better treatment of multiple sclerosis. Now you are writing the first paragraph. Suppose if you are not good at grammar and you are unable to make this line for the better treatment, don't write it. Because the main thing is that who has been attending our community center, now he's moving to Marlborough. So from now onwards, he will be taking continued services from your center. Because I am writing the letter to Community Health Center Marlborough. So this is complete. This is complete purpose that he was attending our community center since 2007, has been attending. Now he is moving to Marlborough. So from now onwards, he will be taking continued services from your center. So if anything that is compelling you to make a grammatical mistake, better not write it. Then you can later write it now. Mr. X is a known case of multiple sclerosis, hypertension. You can write in the second line and this cholesteremia, whatever thing was given. So make it simple. Anything that compels you to make or you are doubtful that you might commit a mistake in the first paragraph, better not to commit even a single mistake in the first paragraph. The main purpose is that he is moving to your area. That is why he will be taking continued services from your center. That is the main point. So please understand these strategies that rather than making it complicated, you just have to. Otherwise, it was not very difficult. Marlborough for better access to the treatment of multiple sclerosis. That's it. Write only the key points. That is what I means. We normally think we should write too much, but in OET we have to write less. That is what I'm trying to say by all this conversation. The now how to judge whether we will get 450, we will get 350 because everybody has got the same question paper. So how will we get 450? How will we get 350? That depends upon how many mistakes you do. If you do not do any mistake, you will get 450. If you do three mistakes, you will get 400. If you do four mistakes or five mistakes, you will get 350. If you get more than five, you will get 300 or less. If your purpose is correct, they will surely pass you. If purpose is correct, grammar is correct, then you will most probably get C positive to B. And if your purpose is correct, grammar is correct, spelling mistakes are correct, nobody can fail you even if by chance you write 220 to 230 words. Nothing to erase. Some people write it, then obviously sometimes letter goes to 220, then they start erasing it. If it is more than 230, then erase it. Otherwise, don't let it be. You will still get 300. Don't erase it. Don't panic. If letter is very smooth, nicely written, first paragraph purpose, second paragraph social history or medical history, third paragraph hospitalization, yeah, social history and medical history, third paragraph hospitalization, fourth paragraph purpose in detail, you are all good to get B grade. Nothing to worry. So this is what I expect. These are the common letters which are coming because they are different letters. The purpose has been the a person has been attending our community center. Now he is moving to some other area because of the reason. So from now onwards, he will be attending your community center. And you can all understand the connectors I have used. However, he is moving to Marlborough. So after comma, I have used so. If I have to put a full stop, then I will say therefore from now onwards, he will be taking continued services from your center. Make it simple, right? And this letter, which again is expected because that's maximum times this kind of letter will come, then you simply say, this letter is being written regarding Mr. X, who was referred to our hospital due to this reason. Now he is better, so he is being discharged. Being his GP, you are requested to provide him the follow-up care. And now, oh, one more thing I can see. When you revision, it is known as proofreading. Revision is very important to eliminate your mistakes. Suppose if I read this letter, I was thinking it is 100% correct, but let me read it. Whose fracture was confirmed with X-ray, for which such a nice connector, for which plaster cast was applied. Now his condition has improved. Therefore, he is being discharged, but he needs follow-up care. Being his GP, you are requested to provide the follow-up care. Now follow-up care is coming two times. So you can say required care. He is being discharged, but he still needs follow-up care. Now this is a better word. But he still needs follow-up care and being his GP. Now let's make it smooth. And being his GP, therefore he is being discharged, but he still needs follow-up care. And being his GP, you are requested to provide him the required care. Now see the smoothness. It is known as fluency of the letter. Like speaking has fluency, writing also has its fluency. That's known as cohesiveness. So now see this thing. This letter is being written regarding Mr. X, who was referred to our hospital due to suspected fracture. Here, fracture was confirmed with the help of an X-ray, for which plaster cast was applied, and now his condition has improved. You can make it still better. And now, okay, if I say it is a big line, I will put a full stop as a result. This is what connectors are. Simple connector. Plaster cast was applied. As a result, his condition has improved. This is better. As a result, his condition has improved and therefore he is being discharged. Let's make it simple. I will make the connectors. Therefore, he is being discharged. Full stop. However, he still needs. Now you will say, sir, there is no change. Why are you changing all this? What I am trying and do, I am trying to use only one connector in one line. Earlier in this line, it became a big line because three connectors were there, because there was another and now his condition has improved. So I was using three connectors in one line. So avoid this thing. Make simple line. Use only one connector in one line. Make line such like in the first line, the only connector I have used is who. In the second line, the only connector I have used is for which. In the third line, the only connector I have used is therefore. And in this line, however, he needs this and being his GP. It is easy to read. That is the way to take marks from 350 to 400 because it eases the examiner to understand and to read. This is the logic of getting more marks. So when I make it cumbersome, see the cumberness of this line now. Here, fracture was confirmed with X-ray for which plaster casts were applied and now his condition has improved, therefore he is being discharged. You can't understand. There are so many connectors. So while using the connectors, be cautious that when a pause is required, take a pause. That is the verb. That is the main purpose of full stop. Full stop means hang on and make an image. So now I'm making an image. This letter is being written who had fracture, who had suspected fracture. Here, fracture was confirmed with the help of an X-ray for which plaster cast was applied. Easy. Now you hold on. As a result, his condition has improved. Therefore, he is being discharged. Hang on. However, he still needs follow-up care and being his GP, you are requested to provide him the required care. So that is what is easy to read. And this is subconscious mind. This gives you that A grade. So I have so many things to teach, but this video would be more than enough to make you understand how to score better, how to take OET writing from B to A grade or from C positive to B grade. Write as simple as you can. I'm telling you, please understand this video. I want to tell you, write simple. Purpose should be clear, grammar should be fine, and don't use connectors. Overly use of connectors also lead to losing of marks. So don't use it over. Try to hang on, make a good line so that examiner reads it very nicely and easily. The easy he is while reading your letter, the more marks he will give you. This is Dr. Bhupesh from Dr. BKM Institutes. Subscribe our channel if you have not. Contact number is 76967 34256. Thank you.